Cool. All right. So my name is Ryan, and it's really an honor to be here tonight. I'm a person in long-term recovery from a substance use disorder, and I'm also a survivor of multiple overdoses, and I'm lucky to be a survivor of the war on drugs. This has been an amazing night. It's been an honor to share this with you all. Um, you know, so I'm here to talk about overdose prevention centers, or some of you may have heard them called supervised injection facilities, um, safe consumption sites, or supervised consumption sites, but we're going to go with overdose prevention centers, or OPCs. We already have them for the drug alcohol. We call them bars. Luckily, we ended alcohol prohibition, and people aren't dying from a tainted alcohol supply and going blind. But we're here to talk about the current overdose crisis and a criminalized, tainted drug supply with fentanyl and many other unwanted things in it. And that's why I'm here to share my perspective as a person in long-term recovery and a former injection drug user, survivor of multiple overdoses, and somebody who's alive because of harm reduction, and somebody who uses harm reduction to keep my loved ones alive. And I come from a social circle of people who are alive because of harm reduction, and many of my closest friends have been saved by naloxone. And I'm also from New Hampshire, and we were hit early and hard by the overdose crisis. And in 2014, after my last overdose, I found out I'd been using fentanyl, and I was somebody who prided myself on knowing what was in my bag. Fentanyl had just arrived in a different way. I had seen it before, but it was not a drug of deception. And I entered recovery, and the foundation of my recovery was really traditional and, built on social privilege and access to a social safety net. And treatment saved my life, and, publicly funded social safety nets saved my life. Medicaid expansion, access to mental health counseling, but more importantly, the recovery and treatment that I found was culturally relevant to me. I found a community of people like me. I was able to enter into working in addiction treatment because, I'm not a felon. I avoided felony charges multiple times. I managed to do really well in life, largely because I'm a middle-class, straight, cisgender white male. And many systems that are there to help people who use drugs are really for people like me. And so I started working in addiction treatment and found a meaningful career path using my negative experience to help others. And really, service work was a big part of my recovery journey and still is today. But I kept seeing people whose needs were not met and enduring needless suffering. And there was so much hypocrisy and ineffective policies that were contrary to what we know about addiction. And so I found harm reduction. And harm reduction is a movement of empowering people and building on human dignity, treats people with respect and kindness. And harm reduction gave me a way to love people from my past who need love. And harm reduction is the truth, and I don't really need you to believe in the truth for it to work. And harm reduction is built on science and research and 30 plus years of experience in research. And harm reduction offers people services that meet their needs based on their current conditions, and offering love and respect and compassion. And harm reduction, when it's done right, insulates people from the war on drugs, the violence that occurs from it. And harm reduction as a movement really shifts power and resources to those who are most impacted by the drug war. And that's why we're here elevating impacted voices. And harm reduction keeps people alive to reach their full potential. And, for me, I've continued to reach my full potential year after year, 6 years in recovery. And I found moderation, and I found that cannabis and other drugs add value to my life. And so I'm a person in recovery, but I'm also a person who uses drugs. And again, because of my social privilege, I can come out of the closet as a drug user. But really, this is really a way to, open up the floor for people to be heard, because people who use drugs don't deserve to die. We need to address this insidious narrative in our culture that if someone tries a drug, an acceptable outcome is death. People who use drugs do not deserve to die. There are at least 30 million Americans who self-report regularly using illegal drugs. At least 160 million Americans self-report using a drug in the past 30 days, including alcohol. There is no recorded human history without drug use. The war on drugs has been won. Drugs won. They've always been here. They always will be here. But our people are dying and suffering. And this is why I found work in harm reduction, and I've been promoting harm reduction. And really, with harm reduction, all drug-related death is 100% preventable. But when I say that harm reduction prevents all drug-related death, that includes an evidence-based strategy of providing people who use drugs access to overdose prevention centers, or OPCs. And around the world, there are 120 OPCs, about 30 of them just north of us in Canada. These sites have supervised millions of administrations of drugs. They're legally sanctioned in 10 countries and in 66 cities. And no one has ever died in them, ever. Millions of administrations of drugs. No one has ever died. And in the past few years, we've seen at least 9 US states consider legislation to legally authorize OPCs. And there's other cities around the country as well. And why would somebody want an OPC in their community? You know, that's not in my backyard, no. Because no one has ever died in one. 30 years, 120 sites, millions of administrations, 0 deaths. You know, and every time that I've lost a loved one to a fatal overdose, they were alone and behind a closed door due to stigma. Their needs were not met and they're gone. And if they had access to what they needed, they would still be here. You know, that's 80,000, you know, so, and OPCs save money. And if you can't get them on compassion, get them on fiscal notes. There are many excellent cost-benefit analyses, as well as a lot of academic research that demonstrate that these centers save a lot of money at the local level. They reduce healthcare costs, they reduce disease transmission, they increase access to treatment and healthcare. One study found that San Francisco, if they had an OPC, they would save about 3.5 million a year. Another similar study found that Baltimore would save $7.8 million a year in public health costs. This is an uncontrolled public health crisis, and we have a way to rein it in because we're losing 80,000 Americans every 12 months to drug poisoning. They're not overdosing, they're being poisoned by a tainted drug supply, and it's not an accident. That's 80,000 people a year whose needs were not met. That's 80,000 policy failures, 80,000 American casualties of the war on drug users. And that's all preventable with comprehensive harm reduction strategies. So look at the science, the research, the evidence, listen to people with lived experience, you know, create equitable access, you know, elevate impacted voices. But the evidence shows that these programs work. And New Hampshire is proof of that. In 2017, we legalized syringe services programs or needle exchange programs, expanded access to naloxone and medication-assisted recovery. We embraced and funded harm reduction, and for the past 3 years in a row, fatal overdoses have decreased in New Hampshire. And that includes 2019 to 2020, because from 2019 to 2020, the nation's fatal overdose rates increased by 23%, but New Hampshire was able to decrease by nearly 5%. Because what did we do? We removed all barriers to MAT, telemedicine, same-day access to buprenorphine, and I see it saving lives, reduced barriers to medication. Look at what France did with their overdose crisis. We increased access to naloxone. We're funding certain service programs, including using money from the CARES Act because the Surgeon General, Jerome Adams, endorsed these as an essential service. So we're funding certain services. We're innovating addiction treatment access and creating recovery-oriented systems that embrace harm reduction. And not only that, but in New Hampshire this year, in the New Hampshire State House, we have bipartisan support on a bill that would allow for OPCs to operate in New Hampshire. We were one of the first states that were hit hard by fentanyl in the overdose crisis, and we're trying to follow the science and research and evidence to find a way out. And our elected officials have been listening. We have growing support for this bill on both sides of the aisle to bring OPCs to New Hampshire. But if we did move forward with it, the Department of Justice would have something to say about it. There are some antiquated policy barriers and some loud drug warriors that are preventing us from saving lives. There's widespread interest in OPCs coming to jurisdictions all over the country. But there are 2 specific sections of the Federal Controlled Substances Act that would block legal OPCs from being operated. Obviously prohibition against possession of controlled substances. You can't have illegal drugs. but also there's a prohibition against maintaining a space where drugs are being consumed, named the crack house statute, something that Joe Biden came up with. And, there's the crack house statutes, but enforcing these provisions criminally could result in asset forfeiture, criminal civil offenses, and DAs and county attorneys don't want that. And so our federal government must act. Joe Biden is an architect of the drug war in the prison industrial complex. He wrote the crime bill, the RAVE Act, the Patriot Act. He wrote the crack house statutes. Harry Anslinger is dead. Richard Nixon is dead. Joe Biden can still undo the wrongs of his past through an amends process. Please, I'm imploring our elected officials, end the war on people like me. The executive branch and our elected officials need to move to lift barriers to OPCs. We need to deschedule, decriminalize, and decarcerate our people and see the value in a failed experiment. Prohibition doesn't work. Law enforcement and the criminal justice system have no business addressing health issues. Taking people into captivity and taking their rights away and their belongings away is not effective public health. Actually, it's why we're in the overdose crisis. So we need our elected officials to legislate, and while they talk, we're going to be out here dying. So we need to unify and enhance existing support systems, create drug user unions, set up your own OPC. The public blessing will come. People who use drugs need to support one another and insulate people from the drug war. In every community, we need harm reduction and people to stand up sites and love on one another and provide access to naloxone, treatment options, housing first models, stop criminalizing people, drug checking, and a safe supply. And soon we will see legal sanctioned above ground OPCs in the US. And thank y'all.